Thank you for agreeing to host this session within the OTT Conference 2021. And just as a background, I think we wanted to leverage on our event last week for the Kenya Think Tanks Forum. And because we are in this think tanks space, we can continue the dialogue on these various platforms. So I want to welcome all of you. We are waiting for Frida, and yeah, maybe I'll just give 1 minute each to introduce yourselves, then I'll go into the question. So let's start with Jared.
Thank you, Eliud, for this opportunity. My name is Jared Owuor. I work with Samuel Hall. Samuel Hall is a social enterprise specializing in research, policy design, monitoring, and evaluation with a focus on contexts affected by migration. We are based in Nairobi, but largely working in the Horn of Africa, West Africa. We also have a footprint in Central and Southern Asia. We're in Afghanistan, Pakistan, we're in Iraq, and we also have an innovation center in Germany. At Samuel Hall, I am the regional operations officer, and I take care of research operations in Africa, and I also support development of research methodologies and tools with a focus on emerging technologies and their impact on refugee support services and systems. And I'm very elated to be part of this very great team, and I look forward to the conversations around the thematic aspect of the day. Thank you.
Okay, thank you. We move to James.
Good afternoon, colleagues, and thank you, Chair, for this opportunity also to speak on this conference. I work for the Kenya Medical Research Institute, KIPPRA, as a senior research scientist on aspects of health system strengthening and knowledge management. Chair, the word Kenya Medical Research Institute has spelled out is a semi-autonomous government organization, popularly called SAGA, within the Ministry of Health, and we have a clear mandate of conducting research in human research for health in the human population. And therefore, in the context of what we are going to discuss today, KIPPRA plays a three-point critical role, and we'll be highlighting it as the discussion goes on. And it will be interesting to network with other sectors, as I will highlight later. Here as part of the introduction, and I'm excited about the topic of the day. Good afternoon. Back to you, Chair.
Okay, we move to Rachel.
Thank you very much, Chair. My name is Rachel Osendo. I work with the Kenya Law Reform Commission. The Kenya Law Reform Commission is a state agency, and we basically provide technical assistance to both levels of government, that is national government as well as county government, and we assist them to develop legislation, to develop policy, to develop regulatory framework, as well as administrative arrangements that are actually in line with the political and socio-economic agenda of the country. And we also undertake research, and we mainly undertake research that is going to advance law reform. And we also undertake public education, of course, that is also going to advance law reform. And so our role here today as a Kenya Law Reform Commission is the fact that we are at the center of preparing fit-for-purpose legislative policy and regulatory frameworks. And so with the building back, of course, we will have a lot to discuss in terms of what strategies or what changes we have adopted as KLRC to be able to actually accommodate the unknown to the known. Thank you very much.
Okay, then Frida.
Good afternoon. Thank you very much. Sorry, I joined a little late. So I'm Dr. Frida Njogu. I am the East Africa Regional Director for IDInsight. And IDInsight is a non-profit advisory, analytics, and research firm that provides leaders in the social sector with evidence and data to guide decisions and guide policy, contributing towards social impact worldwide. So our primary agenda is social impact, and we come there with just an agenda to hear what their evidence needs are and actually go ahead and provide them. So we do a lot of demand-driven evidence generation and support. Yeah, so I'm looking forward to having a discussion, probably share some of the reflections we have about how we can best, adapt to this that we found ourselves in. Yeah, thank you very much.
Okay, so fine. I think we'll then get into the discussion, and this is a conversation, and I think I'll shoot 2 questions around which our conversation will be structured, and I will start with Frida. How has IDInsight been rebuilding amidst COVID and even after?
Okay, thanks. I want to just talk about it in 2 ways, in terms of some of the things that we have changed in terms of how we work, and also a bit of on the institutional side. One of the things we have done, or one of the things we have learned, is that we need to, during COVID and even in future, similar public health epidemics or other situations that actually cause us to change how we work, is how to be able to move faster, to have flexible capability, and to be linked with decision makers. I think some of the things we have, we've actually developed some capabilities in terms of the work that we do. For instance, I'll give an example. One of our products, or one of our what is called data on demand, where we're able to actually quickly do a phone survey in a state level within 2-3 weeks, and have that report available with government. So just thinking, how do we work? What can we change? Traditionally, a lot of surveys have been done, and they're very expensive. They take years. But then, how can we change in this space? So moving towards having more nimble ways of collecting information, but also disseminating it. And that's one. The other one is having, and so this is largely talking about how we do our work, but also in terms of having a system that's flexible. One, again, our data on demand, I think I want to mention it. We actually have capability to collect granular data. We've developed this recently, with having teams embedded in to the lowest level, even if it's in the village or in the estate level. Just ensuring that this system isn't just vertical, speaking to a particular disease area, but we're able to deploy that system to collect information on, say, for instance, household expenditure. We're able to collect that information on vaccine fears and so on. So having a system that can actually get us information around broad areas. And thirdly, is being linked with decision makers, so that even if we are not, one of the things that we've done is really be embedded with them, support them to succeed. So for instance, during COVID, one of our projects in Delhi was actually supporting the government there to actually collect information on what are the gaps in terms of in but also helping them to succeed by giving them talking points, packaging information that they can actually share with communities. That's in terms of how we work, including developing capabilities for remote data collection, just rethinking through our protocols where we have to do physical data collection. How then are we COVID responsive? But in terms at an institutional level, I think we've, of course, remote recruitment, remote onboarding, but we've also moved our boot camp. When we engage associates, having them actually do a remote boot camp. So just having to think through our processes, what can move towards a remote system. I think those are some of the things I wanted to mention. I don't think I'll go into details about the financial systems that actually support us. Yep, thank you.
Okay, so just the third question, how has KIPPRA been rebuilding as we try to build back better? James?
Thank you, Chair, and thank you for that question. The Kenya Medical Research Institute, KEMRI, has actually been on the forefront on matters to do with COVID, given that this is our health sector, and we are among the frontline workers. But for the purpose of our discussion today, our participation, as just as a way of intro, is that at KEMRI we are at 3 levels. Number one, we were part of the national COVID task committee that was advising the ministry and the presidency and the counties as well on best way to resolve or to go about this. So we are part of that committee, and the think tanks or the 2-3 scientists who were there were providing critical evidence to inform decision making at that national level, how the nation will respond. The second part is that the institute was involved in testing, and the testing of the COVID. In fact, it was some of our scientists who developed the rapid molecular diagnostics of mass testing of the COVID-19, and therefore that skill, that extra knowledge that was adapted rapidly across Kenya, was actually a skill that was developed here. And the third level is that we are knowledge generators, and during the COVID, we were involved in rapid operational research studies that were largely funded by the Exchequer. And these research fundings were informed by the gaps that were coming from the National Response Committee on what is ailing what. And one of the, I just get excited to highlight one of them, is that they were able to demonstrate that the mental health, what we was observing during the lockdown, that mental health was not as a result of the illness or symptoms associated with COVID, but the stress and the breakdown of family order, society structure was on more of economic scoping, which now this other mental related issues such as killings in the family, element of the youngsters, these were just response mechanism to the economic stress and by extension mental illness. This is how we were heavily engaged on the 3 level. Tanks, we have a specialty in doing what we call systematic reviews. We have strong methodologies, and our scientists were able to go back to literature, and then based on the skills and knowledge and experience, we are able to link what the reviews of empirical studies and the current possible scenarios would be, and therefore building. I'm happy measures that you are actually data-driven, evidence-informed, and we have generated forecasts and into big data to assist in modeling the COVID wave pandemic. Chair, going to the future or going forward, I would like to say this, that one of the things that is the need to have a rapid research review mechanism, rapidly that can turn around. They can be given a question, and within 24 hours, 48 hours, 72 hours, they present a well thought out, systematically evidence based from existing literature. So that mechanism actually helps a lot. The other, we are building on the existing tools, and therefore, yes, we have these statistical tools for analyzing big data, but we are bringing in artificial intelligence, AI, as part of the we need to add. Then the other new tools such as Power BI, Tableau, which actually visualize and allow you to go deeper insights, are actually being adopted in the institute, and it is helping the tanks here to be able to see the different scenarios. And finally, partnerships with other sectors. We were more close to the health sector, but we have learned, let's work with the other sectors. Agricultural sector, water, energy, finance, cooperatives. These are some of the sectors that we can work with, because the coping mechanism in the society is dealing with the other sectors, that yes, collectively we can participate. This one we learned as we sectors, the livestock sector, and particularly the cooperative, whether they were able to remove the financial strains on the community. It allows, therefore, the community to build back better health systems. And Chair, the last part is that we need to the surveillance important. For future pandemics, we need to put a kind of surveillance that will pre-warn or warn, and in scenarios. It is not strange it became a pandemic, but what are the lessons, and can we frequently repeat or do tabletop simulations? The Institute has done very well, which is also it's a highly pathogenic agent, but because of modeling and simulations, we have taught the Ugandans and West Africa as an institute on how to respond to forecasting, building scenarios, possible scenarios. So my summary is rapid research review mechanism is important. Context relevant recommendations for quick uptake policy and decision makers is equally important. Leaving nobody, all sectors matter, even as we draw our lessons, and finally adapting new tools. This is a research institute. I submit, Chair, back to you.
Thank you, James. I know you've done quite a lot being frontliners, and going forward, I think you remain very vital to any other future pandemics. Let's hear from Jared. Jared, the same question. How have you been rebuilding after COVID? What has changed? The work you do with communities and across the region. Have you restructured your systems, your structures, and so forth? So, Jared?
Thank you, Chair. Thank you very much for leading this conversation. And maybe my contribution would be a mirror of what James has talked about, but in a more contextualized way as far as our work is concerned. As I began, I had actually mentioned that we work with communities that are affected by migration. And with this, what we have always been known to be good at is a question that we asked ourselves when this pandemic struck. And some of the key questions we were asking is, how do we still maintain the identity that we are known for without faltering in terms of standards? Or how do we even become better? And with that, the question would be, what were we used to doing, or what were we known for? One, we have always taken pride in having access to the world's most complex and fragile settings across the global south. And these include, working with the forcefully displaced populations like refugees, asylum seekers, IDPs. And the question we asked then, like we all know, these are some of the groups that were hardly hit by the pandemic, in terms of access to basic services and all that, and the survival became an issue. So the question was, how then do we continue, even with the regulations that are in place in terms of travel, how do we continue to access these complex settings too? Another question was, how also do we maintain the high quality expert analysis that we are always known for, especially based on contextual knowledge and academic rigor? And we had to, again, innovatively think around those issues and decide what do we need to do better and how do we then put our best foot forward. And then lastly, the question was, how do we continue, maintaining actionable and adaptive counsel that helps to build, develop, and improve programs and policies across the regions that we work in. And by rethinking our approach, I think over the time, have continued to positively influence programs and policies around the country, the region, and even the continent, because the knowledge that we have produced in our field of study has enabled us to embark on building new partnerships for the sake of peer learning. With this, over the months, we have managed to, get into a memorandum of understanding with different partners in the sector, from the academic angle of it, from the government sector, the development actors. And this has given us a setting to find out ways in which we can, still contribute with the stuff that we are known for without, trying to take cover behind the pandemic. Now, some of our research that we have conducted in Afghanistan have highlighted the, terrible impact, that COVID has had in the communities. And with that, it's not just Afghanistan, and even in Somalia, in Ethiopia, in Uganda. And with that, we have come to a point of also trying to focus our study into other aspects that maybe we did not give priority at the beginning. And that is something I prefer calling it the shadow pandemic. And of course, we've heard of the global community trying to prioritize new pursuits around mental health, gender-based violence, in order to defend the worth of what is already in motion. I think it will also be important to demonstrate across this, intervention what works and also what is needed. Beyond that, we have also, sort of had a thinking around how then also do we interact best with the communities that we usually work with. And there's, call for adopting new health and safety measures, not only just to protect our team, but also to protect the members of the community that we engage with, many of whom are particularly, vulnerable due to poverty, overcrowding, and lack of access to healthcare. At times, sometimes some options are viable, and sometimes we have to struggle with some. For example, if you look at the sector of IT, I know right now everyone has run to seek refuge in ICT. But then the question that we also found while doing this is the aspect of usability from the community perspective. Some of these communities maybe do not even have the the expertise and the experience of using the new methods that we are introducing. And this has, sort of just thrown us back to sort of think beyond us, having the desire to collect data and to analyze the same. How then do we also make the communities in the villages to be part of this in a way that we also don't have that lack of connectivity, and we also do not experience unwillingness maybe to speak to people, like sometimes some communities we have not gone to, and the issue of being strange and issues around how to put it, identity and protection of data. So these are things that we have tried to leverage on, and specific strategies around this in terms of leveraging on technology, issues around testing remote ethnography, and developing visual archives, so that even if we do not travel from Nairobi, then we can easily have a contextual understanding of, say, for example, of a study that we are doing in Afghanistan or Iraq. We have also tried to do e-surveys for institutional perceptions, issues around photo voice, mini FGDs, dyadic and triadic interviews. Those are some of the things that we have tried to put together to ensure that the work that we do still goes, and we are still able to produce actionable and adaptive concept, to help in building policy and also even, formulation of the same. Thank you, Chair. Back to you.
Okay. Yeah, thank you, Jared. I know, Rachel, you've done quite a lot in supporting the policy and legal process. So how have you been able to restructure your working to support the parliament and the executive in these areas? Rachel.
Thank you so much, Chair. And when I listen to my colleagues, submitting on what they're doing to build back better, then I also resonate and see that we're not facing different challenges. What I can start with is that we have definitely embraced contingency measures and contingency plans in the office so that we can ensure that we continue to provide our services to Kenyans. We are a state agency, and therefore we are facing the normal challenges that any state agency would be facing currently, especially when it comes to budget constraints. And we have most of the budget has now been diverted in prevention and suppression of COVID-19. And so some of course, the contingency plans that we have embraced is now even adjusting to the aspect that we are not all going to the office, and that we are working from home, and probably embrace job rotations and issues like that. Just to give you a bit of a background, when I tell you that we serve both national and county government, including the ministries, departments, and agencies, we are serving national government all across the board, including parastatals, and we are serving county governments, all 47, across the board, including their own agencies and parastatals. So before the pandemic, we were already very lean. And so after the pandemic, it has definitely been a challenge trying to meet all these needs. But what we have done is that we have quickly embraced the virtual system of working. I think the challenge that we are facing there is that not everyone in government, not every agency's government is moving at the same pace. And so some agencies have embraced the virtual way of working and others have not. A lot of government agencies, I think you may all know, prefer to retreat into workshops or seminars so that they can have their meetings. And in most of those meetings is where we are able to actually collect our data, because we are sitting down with the officers themselves and we're able to collect our qualitative data especially. So this has affected us a bit, because we may not be necessarily meeting face to face, but we have mended this by ensuring that we are jumping on the virtual wagon and embracing the technology platforms. In regard to our working space in the office as the researchers, because we undertake a lot of research before we produce our legislative, policy, or regulatory products, we have become more intimate in the office, and we have adopted the use of informal platforms as the researchers so that we can be able to exchange information firsthand and exchange information very quick. As soon as the pandemic took place, I think you all saw that there was a huge raft of legislations that were being passed and legislation that were being formulated so that we could be able to manage the situation. And so we are now on toes proper, and we are exchanging our information at a faster, at a more intimate, at a more higher level. We have also strengthened our partnerships, and I think I'll agree with James that we're not restricting ourselves also just within the legal sector, and of course our key partners would ordinarily be Parliament and probably the institutions that we are working with. But we have actually stretched our partnerships to outside the country. There are a lot of initiatives, especially amongst the Commonwealth governments, on how to deal with the dynamism of how legislation and policy is moving as we deal with the pandemic. And so we religiously attend a one-month seminar that is always organized by the Commonwealth, and it's on rule of law. We have also synergized with the law reform agencies across the world. We have the Asia, we have the African law reform agencies. We are engaging much more on that. We have a Commonwealth Association of Legislative Council, and through that platform, we're able to actually share the challenges that each of us are facing in our own countries, even as we develop legislation. Remember, some of the highlights we made last week is that you're developing legislation, but at the same time, you need to remember that you're not going to infringe on the rights of the people. You're not going to take back what the people have been enjoying, but you need to also apply the reasonable pressure to be able to achieve. So I'd just say that those are the ways in which we are actually engaging. The last issue would be, in terms of public education, we may have suffered a bit of a setback on that because we are not able to meet the people. We had a countrywide strategy where we would go to the counties and we would actually discuss with the counties, depending on an issue that is very particular to them, which is connected to law reform. But for that, we have embraced our social media platforms, and we are more active on our social media platforms. It may not be where we want it to be, especially because not every Kenyan has access to the online, to be able to be online or to afford to be able to be online. So back to you, Chair. I'd say those are my comments.
Thank you, Rachel. I know Frida had requested to step out. Maybe I would request you to talk to the second question on how do you see the future? Supposing COVID does not go away, we'll continue some of the challenges we have, but how do you think IDInsight will look like, say, 10, 15, 20 years to come?
Thank you, Dr. I don't have this situation in the next 20, 30 years. COVID would kill all of us. Having said that, so some of the things that we are looking to, I think, or to do, more and differently. I mentioned about, being linked with decision makers. One of the things that we want to expand, one of the engagements with government that we want to do is to actually have, more of learning partnerships. So we're actually embedded with them, because we think that when this kind of, emergency arises, they tend to resort to people they have worked with. I gave an example, I think, in a recent meeting about, the government of Malawi. We were working with the Ministry of Gender and Social Protection on, some social cash transfers. And the minute COVID hit and more people became, newly vulnerable, then they came to us because we had already had a relationship. I think there wasn't much time to, to go through the whole process, and they quickly came to us to actually help them think through, and target cash transfers related to COVID. So for us, is in terms of, the point that I mentioned about being linked with decision makers, this is going to be this is something that we want to continue growing. This is an engagement that we want to continue growing. And even if this engagement or the embedding is really virtual, because they are, working remotely and we are also working. So, this includes even capacity building, for governments to be able to, either governments or, other, organizations that we're working in terms of to continue to quickly use data to be nimble as, as challenges are thrown at them, then how can either they make use of existing evidence? How can they request, evidence, and how can we then ensure that we're delivering it in a very rapid manner, in a way that is useful for them? That's one. Two, I think another area that we are looking to grow in is partnerships, and this is partnerships with like-minded organizations. So other, think tanks and research organizations, and this is a big focus for us over the next few years, because we have. And COVID has shown us that, sometimes even movement becomes, problematic. We want to do work in Ghana, borders are closed, what do you do? So just really developing partnerships with organizations that we can then, partner to take advantage of each other's either geographic, space, or even core strengths, so that we're actually able then to achieve more together. And I think this is something that we're going to focus a lot of, I particularly am going to focus a lot of my resources too over the next few years, so that we're able to have greater reach, broader reach, but also then, use our strengths to continue influencing policy, influencing the research space in the geographies that we work in. I think those are the two main ones I want to highlight. I think probably a small thing would be in terms of communicating. Now we are not able to attend, a lot of conferences to share our work. It has made us think, for instance, including, how we are holding this forum, but also then think through other ways of communicating in a way that actually our target audiences can hear our work. So beyond, of course, these virtual conferences, beyond, publishing in academic journals, a lot of, development of knowledge products, sharing, on websites, blog posts, and so on and so forth. I think that's going to be a significant focus for us moving forward. Thank you.
Okay, thank you so much, Frida. about the future. Maybe, James, I give you 2 minutes just to wind up your conversation on how do you think the way you work will change in future, or will it remain the same, James? I know you had shed some light in your first round, but if there was something else you can add, I think I give you 2 minutes before I get back to my other colleagues.
Thank you, Chair, for this opportunity. If there's one punch, one powerful that I can deliver, is that the future for KIPPRA is that it is a learning. We are a learning organization, and that means we can adapt to the various changes. We want to learn internally as think tanks. After we have given out the recommendations, our reviews and publications, we want to do an evaluation, an internal evaluation on the impact and assess the impact. So it's an evaluation of our evidence that we have generated through the various stakeholders. It is important, it's just not important as an institute. Apart from giving, there's that need impact evaluation, so as to see if you channeled out 20 or say 10 or so possible policy papers, policy briefs, how many to action, and the ones that did not get in there, they were not taken up. What were the lessons can we learn from those that were not taken up? Why? Where did we go wrong? So it is internal thing that we are beginning to have a discussion as an institute and as scientists. When our outputs fail to be adopted, whether at the county government, at the national, regional board, or what could the reason be, and what lessons can we share, so that we want to have our outputs consumed widely. We are going to be a learning externally as we work with other sectors of the economy, the agriculture, the finance sector, the transport. What lessons can we draw as it influences the decision going forward, the pandemic and after the pandemic? Chair, one of the lessons we learned is that when you work with the media, be they the fourth estate, but when you work with media practitioners, you see, or we were able to learn how weak our health messages were, and therefore we were able, we wanted to start retuning our messages to speak to address the local issues. So when people are water, power, what's the power of social media in counteracting Western ideas, this or what works for us? So these are some of the things, those partnerships with other sectors will really help us get the health messages out. And number two, they will help the recommendations. We usually say that the bacteria, that virus, it remains the same. Medications will remain the same, more or less the same, but it will be the approach. So can we get the water sector, the energy sector to help us? Bacteria, they also have and Chair, this is one of the most difficult part because it calls for the think tanks to be able to accommodate very divergent views into the existing view. That is a skill on its own that think tanks we shall learn going forward, so that if we are not on the same length, Chair, you are thinking capacity or you are of how can I come down to a level in which the gatekeepers, for example, in the pastoral communities, the gatekeepers will tell you 1, 2, 3 things, and you take it up and make it without, ignoring or looking at other sectors as non-important contributors to a post-COVID era. It all matters. Station is what the institute is going to be. I submit. Over to you.
Okay, thanks. So Jared, how does the future look like when you project? Are things going to remain the same, or will emerge unique and different?
Thank you, Chair. Just as also been contributed by my colleagues, one thing that is very clear and certain is that COVID-19 has reshaped the ecology of global research and continues to reshape it in different dynamics. And that as it is, from where I sit as a person and as the work we do as an organization, I would look at the future in three categories. One is on resilience, two, in solidarity, and three, humanism. I would clarify further. When we look at resilience, so far, even from the contributions that we have had, we are seeing that there is evidence of potential positive changes. Then, amidst all the challenges that, of course, we are all experiencing. But with that, the question should be, how can we sustain these changes and have a collective commitment going forward? And with this, I think we are going to be in a very better position. Of course, not praying that something akin to this, befall us again, but just saying that we will be more aware, we will be more prepared, we will be, having the strategies and mechanisms in place to navigate without losing focus of what our core mandate and core business is as an organization. Secondly, in terms of solidarity, and this I'm looking at from angles in terms of connection and partnerships, not just on peer level, but within researchers and communities. There are methodologies that we have picked going forward, even beyond ICT interventions. The question is, how then do we use this to build a more solid connection between researchers and communities? Two, how do we also then ensure that we have a solid engagement amongst researchers themselves, beyond the national borders, beyond the region, so that we have a global network that has a solid voice on matters that are affecting research as a whole, and also maybe cascaded into specific sectors, like for us, migration, for example. But then again, all these sectors are interdependent. Then how do we want to leverage on that and tap on the skills and the insights that we uniquely have? And lastly, of course, the broader engagements between researchers, government, development partners, so that we do not work in silo. We have a collective intervention. We have a common voice, because again, if you look at all this, respective of sectors that we are in, we have a common goal. Largely, policy looks at improving human life. That is all we are in, whether it is clinical research or in migration research, agriculture, and name it. We have a common goal to better humanity. And then, of course, lastly, I'm looking at things being done differently, around humanism. We as an organization, we do, research around inclusivity, and our main goal and agenda is to ensure, like I'd mentioned, ensuring that community voices are not lost. So then, how do we continue, researching with the intention of improving the state of humankind? And this we will develop on, styles and ideas and values that we have picked, since COVID hit us. And then again, to make our approach, more involving and contributing to the larger global agenda. This, in a nutshell, will help us, and this is just to build on what we had discussed in the Kenya's think tank forum. One, this will directly inform the future in a better way, in the sense that we will be able to strengthen measures around pushing for policy evidence. And this again will also ensure that at the organizational level, we strengthen institutional capacities so that we are able to translate knowledge into actionable policies. And then, of course, my main desire is that whenever such a thing happens, as researchers, we look beyond the global pandemic and also, spare resources and time and knowledge to focus on shadow pandemics, so then we do not leave any vulnerable components of the society behind. Thank you, Chair. Back to you.
Okay, thank you, Jared. I know we are remaining with just less than 10 minutes. Rachel, 5 minutes on how do you see the future?
Thank you very much, Chair. I think that we are moving in the same direction when I listen to what my colleagues have to say. I think one of the things that we need to embrace, I would say, especially as an institution and generally for players, especially who are formulating legislation, policy and regulatory frameworks, is that we need to embrace a more robust and a more frequent impact assessments. And I think this would cut across the board, whether it be legislative, regulatory, or policy. And I think we need to entrench this now as a culture proper in our country. We have our uptake on regulatory impact assessment has been quite low. We have not even, we don't even quite have a coordinated way in which we need to undertake this. And I think with the way that things are moving very rapidly, then we need to embrace this. That is one. The second issue, I think, is that we must now invest in infrastructure. And I think government must invest in infrastructure. Private sector must also invest in infrastructure. And this would also be internally for us as an institution. And this would definitely enhance our connectivity within government institutions, which is very weak at the moment and facing a lot of challenges because of the different paces that we're moving at, but also to look beyond the borders and also look beyond government so that we can find a way that we can have synergy also with private sector. The other thing I would also contribute is that as an institution, I think we now need to embrace using online tools to be able to collect our data. We have been very used to engaging in physical meetings where we collect our qualitative data, but now I think we need to find a way in which we can embrace online tools and see how to disseminate the same across government, both national and county as well, so that we can see whether this would be a way in which we can be able to collect enough information and data so that we can then produce legislative products that actually reflect what the people are looking for. I think also the other thing would be to demystify some of the legislations we have. I know we are facing a lot of challenges with one of the acts, which is the Statutory Instruments Act. We need to demystify that so that we can ensure that we also encourage ease of doing business and that we don't have then legislation in place that is actually impeding Kenyan businesses to thrive and to prosper, noting the different changes that are happening very rapidly. And I think the other thing is, and I think Frida had mentioned this, is that we have to now embrace the new norm and actually embrace ways of partnering. Things are not business as usual. And I think for us, especially as government institutions, we now need to find ways of going out to actually partner and identify the people who can help us to actually achieve our mandate. For us as KLRC, I think we really need to just get back to the drawing board and see, especially in terms of engaging with the county governments. There may have been a bit of a disconnect as soon as the pandemic came in, with the county governments facing the challenges that they're facing. But I think we must now find new ways of partnering and new ways of engaging. And I think lastly is that in my office, I definitely see that we now need a proper liaison office that can especially strengthen with the legislative assemblies at the county level, because we have really had a bit of a push and pull in terms of trying to see how we can assist them during the pandemic. And they seem to have been thrown almost into a disarray when the pandemic came in, with a lot of the directions from government being very centric and coming from national government. So I think those are some of the comments that I would actually make at the moment. Thank you very much. Back to you.
Okay, thank you, Rachel. We have gone through the loop and had very interesting discussions around the work we do as a think tanks and how this is likely to change as we move into the future. But I think for the audience who are not part of us, these are members of the Kenya Think Tank Forum. In Kenya, we have a forum of think tanks, and we meet annually. We had our meeting last week, and we were invited here, and we thought we can leverage on some of the discourse we had last week to continue the debate on this platform. And we want to thank Enrique, I think, for the invitation, because I think without his invitation, we would not be here. And of course, to thank the team. I had a team of 4 of my colleagues from members of the Kenya Think Tanks Forum: Rachel, James, Jared, and Frida, who's left. And I want to thank you for the time you have taken to be with us and to make very insightful presentations or conversations around the questions that we have been discussing. So, ladies and gentlemen, I was only moderating. I was moderating the session. My name is Eliud Moyi. I work at the Kenya Institute for Public Policy Research and Analysis in Kenya. Meanwhile, we provide a secretariat for the Kenya Think Tanks Forum, which has about almost 60 members. And I think going forward, we would engage and invite some of you to our future events, I think, as we continue to confront the challenges we are facing with the COVID. So I think, colleagues, thank you. It has been a good session. And to OTT, asanteni sana, and to my colleagues, asante.